When I was a child, my grandmother was diagnosed with rheumatoid arthritis. I did not understand what it meant back then. I just remember her hands were swollen, painful and achy. She was wrapping her hand around a cup of tea each morning due to stiffness. She would smile through the discomfort, but I could see how it quietly reshaped her life. It was only years later, as I get trained to be a rheumatologist, that I truly understand the uncertainty, the questions, and the journey each patient with rheumatoid arthritis faces today. Today, I'll guide you through what really happens when you are tested for rheumatoid arthritis and when you are diagnosed with rheumatoid arthritis. Welcome all of you RA warriors. I'm Dr. Ananta Subedi, your rheumatoid arthritis coach at the RheumDoc, as well as a practicing rheumatologist here at Empower Arthritis and Rheumatology Center. Now today in this video, I'll walk you through my memory lane and help you learn about rheumatoid arthritis and how you respond, how to react when you are seeing your rheumatologist for the first time. It will help you prepare for your first visit with rheumatoid arthritis doctors. When we talk about rheumatoid arthritis, your story matters the most. Your rheumatologist will ask you a lot of questions. And don't get annoyed with those questions. They are there for a reason. They will ask you, when do you hurt? Where do you hurt? What is your pattern? Those questions are essential for our understanding of diagnosing rheumatoid arthritis. So always try your best to give as good an answer as possible. Hence, noting down those questions and also preparing before the visit also help you understand how you respond to those questions. When we look at the research studies, patient history remains one of the most powerful predictor of early diagnosis of rheumatoid arthritis. Your answers help us piece things together so that we can come up with the right diagnosis. Now, the next tool we have is the physical examination. Your rheumatologist will be doing examination of your joints. They will go through the joint examination to understand which joints are tender to touch, which are painful, which are swollen, and which joints are warm. They will also look at your range of motion of different joints. That is one other important clue of how your joints are inflamed. And based on the studies, these examination findings are the earliest clues to make a diagnosis of rheumatoid arthritis. Hence, a good examination is critical in making the right diagnosis of rheumatoid arthritis. And these examinations are even critical than your lab testing. Now, talking about the lab testing, as rheumatologists, we do order quite a bit of labs, and they are some of the guidance on how we make the right diagnosis of your joint pain problem. And blood test is a key step, and this test could include rheumatoid factor, anti-CCP test, sedimentation rate, and C-reactive protein are the commonly used tests to understand inflammation and also help us diagnosing of rheumatoid arthritis. And combining these blood tests also help us substantiate the diagnosis of rheumatoid arthritis. Hence, blood test is important in making the right diagnosis. But the important tool is sometimes blood tests could be negative, and we call that a seronegative rheumatoid arthritis. Hence, don't get discouraged if in case your joints are looking like rheumatoid arthritis, but your blood tests are negative, it could still mean rheumatoid arthritis. Hence, as we go back on the earlier discussion, joint examination is very important in diagnosing rheumatoid arthritis. Now, the next tool become the imaging studies. Early X-ray may appear normal, so you may need to go through other testing such as ultrasound or even MRI to look for clues of inflammation that is not visible to our naked eyes, or even the doctor may not be able to find those clues early on. That's why we need to use those tools like ultrasound and then the MRI of your hands. And among those tools, ultrasound can also show those changes of inflammation. We call that synovitis much earlier than the X-rays. Hence, many of the doctors these days even use ultrasound as a tool to come up with the right diagnosis in the early phase of rheumatoid arthritis. Now, every time when I listen to a new patient's description of pain, swelling, and fatigue, I always think back of my grandmother, who endured many years without getting the right diagnosis. Her story reminds me that every first visit is a chance to change the arc of someone else's rheumatoid arthritis journey, and it can turn the anxiety into action and uncertainty into answer so that you can get a good diagnosis early on and minimize those anxiety and the pain that comes with rheumatoid arthritis. Now, as a rheumatologist, I also need to understand the emotional toll that comes with rheumatoid arthritis diagnosis and the concern for rheumatoid arthritis. And the truth is, the days and the weeks spent waiting for those test results can feel heavier, and the moment of diagnosis itself can be overwhelming. The pain and the stiffness dominate the days, but it's the relentless, overwhelming fatigue that often feels most demanding and defeating. Sometimes answering the questions of how are you feeling feels impossible, especially when the pain and the tiredness cloud every thought and every plan that you have made. And it's okay and normal to feel anxious, frustrated, or just plain weary during these times of waiting for your diagnosis. To help us better in the diagnosis, always journal your symptoms and your mood for yourself and for your doctors. Track what triggers those flares of your joint pain, and maybe the weather, the stress, or even a restless night might trigger those. Write down every question, big or small, to bring them to the doctor so that we can bring clarity to your questions. And always remember, these feelings are valid. You are not alone in this struggle, and the wait isn't forever. Every day spent journaling, observing, and reaching out is an important step towards receiving the right diagnosis and reclaiming your life with the right treatment. Now, talking about the treatment, starting treatment early within the first 3 months of diagnosis of rheumatoid arthritis has a big impact in long-term treatment and achieving the remission, which is you will be feeling significantly better. Hence, it's very important to see the doctor soon, make the right diagnosis on time, and start the treatment plan sooner the better. Time is so important in managing rheumatoid arthritis. Now, when I look back my childhood, I always remember watching my grandmother struggle with the hidden pain and exhaustion of rheumatoid arthritis. We did not know what question to ask and how to get help, but she just managed her symptoms. Your first rheumatology appointment is your opportunity to break that pattern. Share your full story, including every small detail related with your joint pain and any other symptom you are struggling, such as fatigue, anxiety, depression, sleep problem, and everything else. They could be related. Always understand what each test and answers mean, not just medically but personally. Prepare questions for your next step so you always feel one step ahead. Always ask questions during your visit with the doctors. Now, as always, in the Room Doc, we also encourage a whole person treatment. Hence, I go back to my NESCAR and 4F pillars. The NESCAR include nutrition, exercise, sleep, stress management, checkpoint, seeing doctors regularly, avoidance of risky substances, and creating a positive relationship with yourself and your family. These pillars help you navigate your RA journey better and easier. And this NESCAR is fueled by 4F, faith, family, friends, and fulfillment that truly bring lasting happiness in your life despite the diagnosis of rheumatoid arthritis. So use those two frameworks to help you navigate the journey of rheumatoid arthritis. Now, let me quickly summarize all we talked today into 3 important action steps. Number 1, start a symptom log. If you suspect you have rheumatoid arthritis because of joint pain, always write down which joints hurt you, when the pain started, and snap even pictures of those swollen joints so that your rheumatologist can review those together to come up with the right diagnosis. And always bring your medication list with you. Number 2, ask someone to join you during the visit. Invite a friend or a family members to support you and help you remember all the details you talked during a visit. This is very important for your long-term treatment plan. And always ask questions to your doctor. If you don't understand anything, always be proactive asking the questions related with your treatment plan, related with your diagnosis, and what is our future looks like. As I wrap up this video, I think of my grandmother often. How different her journey might have been with an early guidance and community like ours. That's why I want you to have that knowledge and the community. Please download the free book that we wrote for you. It will include all the details related with rheumatoid arthritis. Also, you have option to download the 3 critical steps that you need to do and 3 things to avoid with the diagnosis of rheumatoid arthritis. And the links are in the comment below. If this video brought clarity or comfort, subscribe to our channel and share it with other people who might be suffering with rheumatoid arthritis. And always remember, you are a warriors. You are not alone. We can bring the pain towards possibilities. And with this community, we can survive and we can even thrive despite the diagnosis of rheumatoid arthritis. I'll see you next time in the next video. Take care. Bye-bye.